Hello, everybody. This is Dr. Hugo Gonzales, clinical psychologist at Cobb Center. Today, we are going to talk about some of the psychotherapeutic techniques to facilitate acceptance in couples. So many interventions can facilitate acceptance. I will only mention a few here. Most important is our tasks to help couples to accept themselves as a way to stop blaming their partners for their disappointments and unmet expectations. One of the techniques that we are going to use is to interpret the projective identification issues that partners are going to present in therapy. For example, if one partner has a fear of intimacy, this partner may project onto the other, and the partner is going to respond with intimacy problems, which consequently is going to lead them to distancing and sometimes separation. So more generally, all our psychodynamically informed efforts to support clients is in order to uncover their underlying issues and to truly empathize, which can be a very important tool to facilitate acceptance. Clients are also going to be aware of psychological hot buttons, such as transference fears in themselves and in their partners. And as such, they will be more accepting of themselves and their partners. Spouses who acknowledge their own psychological allergies will be less insistent in putting unreachable expectations on their partners. In other words, they are going to take personal responsibility and work internally in calming their emotional distress. So it is going to be a consequence of this process that spouses will try not to trigger their spouse's allergies and will be less surprised and intolerant when inadvertently they do. We can also help partners to give up the excessively romantic expectations they may have about marriage. As we all know, some of these follow the honeymoon period of relationship idealization. When then, after the honeymoon period, partners discover that they are different and they need to compromise. Sometimes we can help clients to acknowledge that what they find dissatisfying in their partners is at the same time something very valuable. For example, the hard-working husband who disappoints his partner by coming home very late is also the husband who is going to help to fund the university tuition or studies at the school. The wife who appears very focused on supporting the children is also doing their best in order to to support the family. So partners need to acknowledge that there are pluses and minuses. So through this process, we are supporting couples to facilitate intimacy, bonding, and conflict resolution by giving them a voice and giving their deep needs and injuries a voice too. So as we give voice to the deeper needs, hurts, and injuries that partners have experienced, they are going to become less negative and more supportive and collaborative in the process of the relationship. So sometimes we want to try to teach couples to negotiate differences by helping them state their needs more clearly and less offensively. Instead, therapists are going to assist partners in accepting or containing differences and chronic issues that may never change, that are also called unsolvable or perpetual problems, as stated by Gottman and Gottman. So by diminishing these expectations regarding the unsolvable problems, we are redirecting their focus into more positive issues into their relationship. So by diminishing passive-aggressive non-compliancy, we are helping clients, partners to abandon their efforts to change what seems unchangeable, which sometimes lead paradoxically to the desired changes. But even if those changes are not forthcoming, it helps to diminish what has always been called the most toxic characteristic of couples' marriage and issues. Not so much the unchanging problems, but the incessant nagging over changing them. Thank you.